Hello and welcome to Can Cable 21. You are watching a public access channel about information coming to you that's very, very important. So for the next 25 minutes, we're going to be talking about diabetes and foot care. And joining me today is Dr. Telva Hernandez, podiatrist, and she's going to be talking about all these wonderful, wonderful things you should know about taking care of your feet, especially if you're a diabetic.
Yes.
So Dr. Telva, can I call you Telva or Dr. Hernandez?
Telva's perfect. Thank you very much.
So Telva, why don't you, I know that diabetes and the glucose levels and blood sugar levels, if they're too high, and over time it can damage nerves and blood vessels and so on, and especially circulation with feet and all of that. So Dr. Hernandez, can you avoid these problems? Are these preventable? And if so, how?
The most important thing that anybody who has diabetes should be aware of is their blood sugar. Blood sugar is the basis for how somebody is doing well with their diabetes or doing poorly. And if you have a high blood sugar, you have a tendency to have further problems like decrease in your sensation to your feet especially, and decrease in your vascularity, so the blood that flows down to your feet, in terms of the big vessels and the small vessels that get all the way down into your toes.
So taking care of your diabetes is actually the first thing is that what folks should do is really control their sugar levels.
Absolutely, yes. You should be checking your sugars daily with your strips at home. And you should be seeing your doctor on a regular basis to get your glycosylated hemoglobin or your HbA1c levels. That should be done probably every 3 to 6 months if you're being pretty diligent about it.
Right.
These tell you how you're doing as far as your diabetes goes, and it tells you what you need to be working on.
Right. So making sure that your sugar levels are always where they need to be every day.
Yes.
And obviously tracking that is very, very important as well. Although many meters today already have that gauge in there where doctors can unload that information onto their computers, right? But that information is just so important to make sure that you're maintaining your sugar levels and so on. So doctor, I know that with the feet, a lot of people don't think that, yeah, checking my feet out, they're fine, but they should be checking them every day. And that's somebody who's even not a diabetic.
Yes, everybody should check their feet every day, but diabetics especially should check their feet every single day. You should be checking in a routine fashion so you don't miss anything. Start with the tops of your feet, check every nail to make sure none of the nails are loose or there's no foreign bodies underneath the nails, and then definitely checking the bottom of your feet. If you're having problems with that, I recommend putting a mirror on the floor right by your bedside, so you can do it right before you go to bed or right when you wake up in the morning, and you can see the bottom of your feet. You're looking for any red spots, any blisters, any openings that you may not have seen prior.
Swelling even?
Swelling, absolutely.
Even. Right, and so this is what you're looking for. Now, I know that too, washing your feet every day, and I know it's not something that a lot of people do, although they should be doing. No, I didn't walk barefoot today, and you hear all these excuses why they shouldn't be washing their feet every day. But very, very important.
Very important. It gives you an extra tactile sensation of your feet, too. So instead of just looking at them, you're touching them, you're seeing if anything's hurting, you're seeing if you're finding any blood where you shouldn't be finding blood.
Right.
And keeping your feet clean is the number 1 way to keep your feet healthy, too.
Right. And I know that, too, keeping your feet dry.
Yes.
Now that it's summertime, and I see this a lot even in amusement parks and so on, water parks especially, where people have their feet in water all day. And then they have them and they're wearing those little rubber shoes and so on. Doctor, is that something that somebody, especially if they're diabetic, should be doing?
If somebody's a diabetic, it's important to keep your feet moist but dry, and especially in between your toes. You want to keep in between your toes dry. You never want to put any sort of lotion in between there. That can increase what we call maceration or wetness in between your toes. It's when your hands or your toes get nice and wrinkly. We don't want that to be happening in between the toes because that's where bacteria likes to live and fungus.
So obviously if someone is using lotion for their foot, where should they be applying it?
They should be using it, and they should use it on the tops of their feet and on the
Right.
bottoms of their feet. But don't go past that ridge that gets into your toes.
Right, right. So the idea is avoiding the creases, right? You don't
Avoid
want
those
you don't want to
creases.
get them in there, and you don't want that to sit and stay moist. And that's basically what we're trying to avoid.
Yes.
Right. Now I know that there's a lot of mechanics out there. Folks are always who are actually taking their feet and they're using file on their feet and so
The
on.
pumice stones?
Or pumice. Well, there's a lot of folks out there who are just actually using actual files. Can we talk a little bit about that? And how,
Yes. If you feel that you need to be using a file on your feet, I recommend that you should be seeing a doctor.
Right.
Because that is a very quick way to start an opening in your feet that maybe you're not going to be able to heal on your own,
Right.
especially when you have diabetes. So any sort of callus or corns, any extremely long nails, that's where we come in and we can help you prevent any sort of openings in your feet,
Right.
any sort of ulcerations.
Now, I know that diabetics at times, either based on weight or just reasons that they can't bend over for whatever reason, definitely they should be seeing a podiatrist in order to have their toenails cut and trimmed.
Yes, absolutely.
That's, now, I know that it's recommended. I mean, everyone should cut their toenails, what, once a week?
Once a week is probably sufficient, yes.
Uh-huh.
In terms of diabetes and how often we are able to see people with diabetes, we see them once every 60 days. And I think
Okay.
that that's sufficient because people who have diabetes actually, their nails grow a little bit slower
Okay.
than the rest of the population. So it's okay to have that little bit of a longer wait. We do recommend that if you have no sensation to your feet, if your feet are cool to the touch, that we be the people that actually inspect your nails and trim your nails for you.
Very important. I want to remind our viewers that with me today is Dr. Telva Hernandez, and she is a podiatrist or a DPM. And I'm Lucy Aquino with Hispanocare, a program of Advocate Illinois Masonic Hospital, who brings these shows to you and information on behalf of Can Cable 21 here in Chicago and Illinois Masonic Hospital. So with that being said, Doctor, I know that people are told all the time to wear socks with their shoes. Why is that so important?
Part of it is an extra barrier against what's against the ground you're walking on. A lot of people who have diabetes don't check inside their shoes, and there can be little rocks, and that can give you an extra protection. I personally recommend white socks for all my patients who are diabetic, because if you take your sock off and you can see a redness, that gives you a clue as to whether you're having any problems. It also prevents, it also wicks away some of the sweat that you have, so it can protect your feet in an extra manner too.
All right. So, and it's always good too, I know it's recommended too, to always feel the inside of your shoe.
Yes.
And why is that, Doctor?
Well, I'll give you a quick scenario of a patient that I had. It was a diabetic patient for several years. He was wearing the appropriate shoes, the diabetic shoes, but no sensation, did not check inside his shoe the day he came to see me. He came out with, his sock was red, ulcerations forming just within that day, and I looked inside and I saw a golf ball.
A golf ball.
A golf ball.
Because he had no sensation.
No sensation.
He felt nothing.
And these patients have some very severe problems related to the lack of sensation.
Wow. But the size of a golf ball in his shoe, and he couldn't feel it.
Exactly.
That just goes to show how extreme this is.
And I mean, that is my most extreme case. But yes, and a pebble or a small coin or anything.
Right. So it's really important, and that's why I know that you recommend that folks feel inside of their shoe to make sure there's no objects there or pebbles or rocks or anything else that you've done. So always wearing comfortable shoes is always something that's a good idea too.
Yes, and we always have recommendations. If you have concerns about the shoes that you're wearing, please bring them into your doctor. They're able to fit them for you. They're able to tell you whether it's a good fit for your particular foot type. And diabetic shoes are becoming very stylish now. I know people don't tend to like to gravitate towards that type of shoe, but they are in several colors. They're in several different styles for men and women, and we do recommend them for the majority of our patients with diabetes who have a deformity of sorts.
All right, so summertime's around the corner,
Yes.
and you have a lot of people who love walking barefoot. Doctor, what do you say about that?
I never adhere to barefoot walking, even with non-diabetics, but especially with diabetics, for all the reasons that we've been talking about.
Right.
You can step on a needle, you can step on a pebble, you can step on anything, and it can become a very big problem.
Now, I know that ulcers actually form very quickly.
Very quickly. It can be within a matter of hours that you can form an ulcer when you're stepping on like a rock repeatedly within your shoe. More often than not, you're getting ulcers just from regular walking on your foot, but your shoe isn't accommodating your particular deformities correctly. So let's say you have like a hammer toe. That's when your toe is crooked up like this, and you're walking and you keep on pressing this particular part of your toe against the ground over and over again.
Oh.
So that can cause a lot of ulcerations and a lot of problems for people very quickly. When you have something like that, you should come and have a doctor take a look at it. It's something that can be easily fixed to prevent a very large problem.
Now, also blisters, they form very easily as well for diabetics.
Yes.
Let alone when somebody's wearing a tight shoe who's not diabetic and you get a blister on your foot because you're breaking in new shoes, as we would call it, or breaking in new heels. But when you're a diabetic, these are things that you have to be able to avoid.
You need to avoid them because preventing is an easier thing to do than going through the motions of healing an ulcer, especially when you have an immunocompromised patient, a patient who has decreased sensation, a patient who has less blood flow all the way down to the feet.
Sure. So as we're talking about that, you're talking about blood flow to their feet. So what should people do when they're sitting? I mean, you get all these kinds of recommendations what you should be doing when you're sitting, especially a diabetic. So if you're sitting, what should you be doing with your feet?
We want you to be just every 2 or 3 times a day, just move your feet, move your ankles, move your toes around so that you're getting a little bit of blood flow there. We want you to raise your legs up so that your feet are a little bit closer to your heart, and it's easier for your heart to pump down to your toes.
So, and then they also say don't cross your legs on top of each other for long periods of time.
Yes, you can occlude the blood vessels behind your knees, and that can be a quick detriment to your leg.
Absolutely. So obviously, if you have that ottoman, use it, especially if you're sitting down. Put your feet up, take advantage of it, and relax a little bit. It'll be good for you. Now, doctor, I also know that it's not good to smoke in general, but it's even worse for diabetics.
Yes, it is. It is a very quick way to decrease the blood flow to the rest of your body, but especially to your toes because it's furthest away from your heart. Nicotine in general can decrease the size of the blood vessels all the way down to your toes, and even one cigarette will decrease the amount of blood flow and oxygen that you have within your blood for up to 2 weeks.
One cigarette.
One cigarette.
No, really don't think about those things. And, and a lot of times, as we know, it's an addiction. It's not something that people can easily give up. But but as a diabetic, it's something that they definitely should work towards.
It's something that we can give you resources and counseling. It's really important when you're trying to heal these wounds and when you're trying to prevent these wounds and have as much blood flow to your foot as possible.
Sure. Now, physical activity, exercise is always a good thing. But be more active, especially for diabetics. Why?
It's going to help with your blood sugars. It's going to decrease them just with that amount of effort for yourself. It's going to be helpful for you just with that particular part. But it will also increase your stamina. It increases your blood flow to your foot. And it just makes you all around healthier.
So a person who's not diabetic, just someone in general, should have a foot exam at least once a year.
Yes, absolutely. That would be
And
wonderful.
Definitely something they can do even during their annual physicals
Mm-hmm.
and have their doctor check it in case there's anything there. And if need be, have the referral done for a podiatrist then,
Absolutely.
if that's the case. But definitely during your annual physical, it's definitely something to take advantage of and have your doctor check your feet. It's usually not something that you go in there wanting to remember to do that because you've got other things on your mind. And I'm sure that your feet are the last thing on your mind.
Absolutely.
So check with your doctor, and they're checking for those foot problems. Obviously, if they're diabetics, I know that a lot of times I've seen, especially in our community health fairs, we have seen folks who have actually come in and they're wearing sandals or these rubber flip flops. Not good.
Not good.
And what would you say? It's probably, especially now that we're in the warmer weather, are there any real good shoes to wear in the summertime, or open toe shoes or open shoes that you would recommend or suggest?
It's a case by case basis, of course, but in terms of people who have diabetes, I don't generally recommend any sort of open toed shoes
Right.
because of the problems that you can have with
Right.
something slipping into the foot.
Mm-hmm.
However, Keens are a
Right.
great sandal that you
Okay.
can wear. It does provide some arch support if you're looking for a sandal to be wearing.
Mm-hmm.
We don't want any of the flip-flops with just the two tongs and the flat bottom.
Right,
That's not going to be
right.
helpful for your feet, whether you're diabetic or not.
Mm-hmm. So obviously, if you're going to wear an open toe shoe and or sandal, obviously something with an arch, and I mean they're out there. You can look for them, but it is recommended that you don't wear them because you don't
Absolutely.
want to at any point in time stub a toe or get a cut. And if you have poor circulation and you don't feel it, then what?
Well, if you don't have those particular things, we need to be seeing you pretty regularly, and we want you to be adhering to these guidelines that we've set forward. So wearing socks, wearing white socks, wearing good shoes, making sure that your doctor has seen your shoes so that you're in the proper shoe for yourself. You're not getting any blisters or any corns or calluses.
So, well, then it's not a bad idea. So when you go see your podiatrist, it's not a bad idea for them to pack up their shoes and take them with them.
Bring them with you.
That's a very good idea. Because this way, as you were saying earlier, as you alluded to earlier, was that the doctor then, they can actually review your shoes. Are they good for you? Do they fit correctly? Are they sized correctly? And maybe you might even need an insert to give you that extra arch if need be.
Absolutely. And we're happy to help with any of those.
So it's okay for you to pack up your shoes and take them with you and have your doctor, your podiatrist look at those when you go in to see your podiatrist. So doctor, if you're a diabetic, how often should a diabetic patient see their podiatrist?
We prefer for you to come between 3 and 6 months, with every 3 to 6 months, excuse me. When you are a healthier diabetic with good blood flow and good sensation, probably twice a year is okay.
Twice a year.
But every 3 months if you are having any sort of problems. And if you're having any problems at all, any sorts of concerns about an ulcer or blister, come sooner. We're happy to see you if you're having any problems.
Oh, okay, so I know that at one point, a few years ago, we ran into a woman who had a small blister, and it was probably the size of a pinhead, and she was saying that she was getting these around the bottom of her feet. However, not even 24 hours later that day, she ended up going to the emergency room because it got so big so fast that it burst and ended up going to the emergency room. And before she knew it, there was an infection that set in that quickly. Can we talk a little bit about things like that? Because people look at a blister and they don't think anything of it.
Blisters are a very easy way to get an infection. The skin opens and then you're able to have bacteria go right inside that wound. When you have diabetes, you don't have the proper tools to combat that infection. So your white blood cells are the cells that are combating or attacking the bacteria is not working properly. So you start getting the swelling that she was having, the redness, the hot, the foul odor sometimes, painfulness when you're not usually experiencing pain, any sort of pus. All of these things are thoughts that maybe you do have an infection. And that's when you go to the emergency room right away.
I do want to remind our viewers that today's topic was on diabetes and foot care and the importance of it. And today with me was Dr. Telva Hernandez. Thank you so much. You know,
Thank you.
time here go by is really, really fast, but I know that there's always more that we can share. So, Doctor, you got a couple of minutes. We have a couple of minutes left here. So, what advice would you give if you were talking to your mom? Pretend you're talking to your mom. What advice would you give her if she was a diabetic, and what she should be doing?
I want her to be checking her feet every single day. I don't want her to skip any of those days. I want her to be washing her feet daily and putting the lotions on daily, skipping the toes, of course, wearing good shoes, and if she's having any problems, to come see a doctor right away. Any blisters, any corns, any calluses, anything that's new that you haven't seen before, I'd rather it be not a problem and have you just come see us for 15 minutes than have it be a big problem and wait. We prefer you never to wait for something that has to do with your feet.
All right. And then, of course, it's like I always tell even my family members who are diabetic, and when I'm constantly, chasing them down about things, it's, reminding them, cutting your toenails.
Absolutely.
Straight across, and filing the edges and not cutting them at the edge, because they can become ingrown.
Absolutely. And that can be a big problem.
Right.
It can become an infection again.
Right.
Very, very quickly. So cut them straight across, like Lucy said. And then if you're a diabetic, we would prefer that you come and see us.
So, Doctor, again, our time goes here so quickly, but I would love to have you come back and share some more information with us on diabetes and foot care in general. So with that, inspect your feet every day. Seek care early. If you do get a foot injury, make sure that your healthcare provider checks your feet at least once a year, and more often if you have foot problems. Your healthcare provider should also give you a list and explain the do's and don'ts of foot care. On behalf of my colleagues at Advocate Illinois Masonic Hospital, Hispanocare, and Dr. Telva Hernandez, thank you for being on the show today.
Thank you for having me.
And sharing this wonderful information, allowing us to share with our viewers. I would like to thank CAN Cable 21 as well for making sure that this happens. Thank you, always. My name is Lucy Aquino with Hispanocare. Until next time, stay tuned for more information coming your way. Have a good day.